Welcome back. We're talking about Lyme disease and tick-borne co-infections. This is such an alarming issue. One state on the Delmarva Peninsula sought the help of international experts to find out what to do next.
I think that tick-borne illnesses, we're just going to see more and more of a problem if it doesn't get aggressively handled.
Dr. Kathy Spreen is a retired physician and author of the Compendium of Tick-Borne Disease. Over the past several years, she has been working as a consultant for local and state governments in both the U.S. and Canada, discussing Lyme and its various co-infections.
There's been so much controversy around it. First, the rheumatologist said it was their disease, then the dermatologist said it was their disease, then infectious disease people stepped in, so we don't have a real solid collection of data.
Dr. Spreen most recently participated in the Lyme Disease Prevention Task Force in the state of Delaware, started last summer to study and make recommendations on how the first state should combat Lyme.
Delaware can really be in the forefront of this disease.
Delaware legislators say a major motivator for this task force was this: a 2013 CDC map, a visual representation of Lyme disease across the country. Each blue dot represents a reported case of Lyme, and there's Delaware, almost completely blue. The actual hard numbers from the CDC show Delaware with the 6th highest incidence of Lyme disease in the nation. Maryland ranks 13th, Virginia 14th.
I was shocked when I saw that map. I mean, it still just is emblazoned in my brain at how serious this is for our state.
Delaware House Speaker Peter Schwarzkopf is a co-chair on this task force with Senator Ernie Lopez. Schwarzkopf says the climate, the extensive state parkland, teeming with tick hosts like deer and mice, and all that beach grass makes Delaware a hotbed for ticks. And the task force is the direct result of Delaware Lyme patients coming forward to report their struggles.
2015, there are still doctors that are reluctant to diagnose Lyme disease. They don't even recognize Lyme disease. And we have people come to our meetings and they tell their stories.
On June 1st, the task force, which consists of Lyme disease patients, legislators, health and environmental experts, educators, and representatives from insurance agencies, approved this report, which includes a series of recommendations. From raising public awareness to continuing education for healthcare providers, the task force says taking down Lyme and its co-infections is not just about avoiding ticks. It's about early detection and treatment.
The sooner you're diagnosed and appropriately treated, the better chance you have.
This is a sore subject for a number of Lyme patients who claim they have been misdiagnosed by doctors for years.
I was tested 8 years ago as negative, and I crashed 2.5 years ago.
I've been sick and off most of my life, but doctors just said it was depression.
I was misdiagnosed, 25 plus years if you really want to go back to when I first knew that I had problems, and it took that many years, 25 years, to get diagnosed from a doctor that's not even in the state.
I have been to 20 plus doctors, cardiologists, I've been to 3 rheumatologists, 3 internists, pulmonologists, gastroenterologists, every ist that you can name.
Michelle Green of Townsend, Delaware says that she remembers the exact day she found a tick had bitten her on her scalp. It was last year on August 21st, but when she went to a doctor...
And I basically had to beg him to do the blood work to test for Lyme, and he did not want to do it.
The current 2-tier testing required for a positive diagnosis of Lyme was established in 1995, and 20 years later, the CDC still recommends it. In order for a patient to test positive for Lyme, the first-tier test, commonly called the ELISA test, must test positive first, and then the second-tier test, called a Western blot, would confirm those results. But the ELISA test is considered problematic because it measures the body's response to the infection, not the bacteria itself. And the reason that it's ineffective early on is that experts say it can take several weeks for the body to create the measurable antibodies to confirm a positive Lyme test. This is why in 2011, the state of Virginia signed into law the Lyme Disease Testing Information Disclosure. It requires all medical professionals who order this ELISA test to notify the patient in writing that a negative test does not necessarily mean you do not have Lyme disease, and that if you have continued symptoms, you should contact your doctor about retesting or additional treatment.
One thing we know for sure about Lyme disease is that the longer the interval between the initial infection and appropriate treatment, the less likely there is to be a positive outcome.
Tick experts say the likelihood of infection depends on how long a tick has been attached, but the research on this is inconsistent. The National Institutes of Health say it's 36 hours. The CDC says it's 24 hours. Some state health departments say it's even sooner than that. But the problem is most people who are bitten by a tick don't know exactly when it first attached itself, which is why the task force recommends that doctors and nurses be allowed to treat Lyme disease and co-infections prophylactically based on a clinical diagnosis instead of relying on the lab tests.
I think that this task force is going to be on the right side of history. I mean, Lyme disease, unless we get very aggressive about it, isn't going away anytime soon. And you're going to be seeing more and more and more cases and more people coming in and saying we need educated practitioners that can deal with these cases.
But right now, a positive test for Lyme is often required for most doctors to start antibiotic treatment and for insurance to cover the cost of antibiotic therapy. The task force hopes legislators will pass a law that would prevent insurance companies from refusing to pay for treatment based on a clinical diagnosis.
An insurance company isn't there to make you well, all right? An insurance company is a business. It's to make money for the insurance company, okay? And that's fine. We all understand the role that's played here. However, I posed this back to the insurance company representatives, and I said, you're a business, make a business decision. It's so much easier to treat at the initial outset and so much cheaper. Even though the test is a little bit of money, it's so much easier to have the test and have the antibiotics started than to wait 6 months and then have to treat them for the rest of their life.
A number of people with chronic Lyme symptoms tell 47 ABC they will do pretty much anything for relief. A look at the lengths they'll go after this break.